Hi, you're watching Hindustan Times and I'm Aditi Prasad. Like most journalists, I too have been tracking the COVID-19 virus obsessively for the past 1 year. The gloom and doom that we see today has never been seen before. The wave of corona, SOSs, messages, people asking for help, advice, texts, hospital beds, even oxygen has never been like this. And while the country is living this nightmare, the fifth phase of voting is really underway in Bengal. I mean, it's coming to an end now, but millions of people have stepped out to cast their vote. Election rallies are taking place. The Kumbh Mela is happening where millions are taking the holy dip, throwing all caution to the winds. It's as if politics and religion have seemingly remained untouched by the havoc that this virus and its mutations are wreaking across India. I'm joined today by two frontline warriors, the doctors who are at the forefront of this fight. Let me introduce, and that too from the hotspot Mumbai. Let me first introduce Dr. Jalil Parkar, a COVID-19 survivor himself, who came face to face with death during his fight against the infection. Undeterred, he's now back in action and he's on the front lines in this fight as a top pulmonologist in Mumbai's LILAVATI hospital. I also have with me Dr. Amit Thadani, a medical director of the Nirmalaya Hospital in Mumbai. He runs this hospital that is now a COVID-19 facility and, constantly needs oxygen cylinders every day for patients. That oxygen, which is really in short supply right now. Welcome to the show, sirs. It's really uh, I could not even say it's heartbreaking to see what's happening across the country today. Uh, there are stories of horror coming out from crematoriums, from hospitals, long queues. Uh, India is fighting, and the hospital staff is fighting this uphill battle against the virus. Let me start with you, Dr. Jalil. We saw the viral video of Lilavati Hospital, images of a lobby being converted into a COVID ward of the huge influx of patients. Really, that's not the only video. There are breaking visuals all across. We see rooms outside hospital, patients spending beds, oxygen, medicine. What's going on in Mumbai? How did we get here?
Well, I don't know where to start and where to end. See, the way the video of our 8th floor lobby, which was a COVID ward, the whole floor, the way it has gone viral, I must clarify that we did not want patients in the lobby whatsoever. But the management had to take a call, had to admit the patients because it was just a influx of all the patients coming into the screening and triage area, requiring admission, requiring hospitalization, requiring oxygen. On one hand, y'all are trying to tell us that what our management did was wrong. I don't think at all. I think it was the most just thing that we did, and we saw to it that we gave treatment to these patients. As you all can see on screen, what I'm showing you, that the oxygen, the medications, the nursing, the doctor staff, they were all there, and medications also. Everything was given to these patients. Unfortunately, we had to increase the number of beds. Now we have also increased on another floor. First of all, 6th floor was only COVID ICU. The 8th floor was only COVID ward. We have also opened up the 7th floor. Now, what more can we do? Is it right on our? Is it wrong on our part that we did not do justice by giving treatment to the patient? I don't think so. So the the people who have been critic and who want to sit outside and they want to see all this and say that this thing is not the right thing to do. I think they are no one to say that. Anybody who has any objections, they must come and see the ground realities. Please do come and see the ground realities. Our triage is overflowing. We have a triage in the basement from where the patients are taken into the COVID wards because it's an isolated area that we have created. it is full. We have to make patients sit on the chair to start the treatment, at least give them oxygen, examine them, take their vitals, etc. So, where have we wrong? On one hand, you have the government who is saying that we should give treatment and extend our beds to whatever more than the capacity. That is what we are doing. That is what we have been doing for the last 1 year. Come on. Aren't we supposed to do all that? Aren't we supposed to save lives? Uh, I don't understand the rationale that, on one hand, when you show that there is, you know, an influx of patients which is like a tsunami, and you want us to treat them. On the other hand, when we give services, then you want to become a critic and say, oh, they did that in the lobby. I think that's very absurd and it's
And
unheard of, and I think it
absolutely,
should
sir.
not be said so.
I completely agree. But my point was not to say that, yes, those people who reacted absurdly on Twitter, saying that this is how this is what is happening. They're probably not realizing what's actually happening in the hospitals, as you rightly pointed out, and which actually brings me to my second question. Uh, you know, there's a shortage of hospital beds. There's a shortage of remdesivir. Whether you want to, there are opinion is divided on whether it should be used or not. But oxygen, hospitals are on difficult. And some say that just 10% of oxygen is left in many Maharashtra hospitals. And I want to talk to you about the circumstances under which you, the frontline warriors, are actually giving out treatment to patients who are lining up. And then I will come to you, Dr. Tani, to take your opinion on this whole shortage. That's uh, Dr. Parkar first.
Yeah. So, can you hear me?
Okay, yes, please. Okay, Dr. Tani, please carry on.
Now, at my hospital, Niramaya Hospital, we did face a problem of oxygen, and it came very, very close to a disaster where we were about just barely 2 hours away from running out of oxygen altogether. So we saw such a situation happening in the last 2 days at two major institutes in Mumbai, and Bhagwati Hospital, which is a huge hospital, ran out of oxygen and had to transfer patients. If the government cannot maintain its own oxygen lines, how are private hospitals supposed to do that? Right? There is a shortage. It's not going to go away. I had pointed this out earlier also, because at this time, many states have gone down together. The wave has hit many states at one time. Earlier, during the earlier first wave, what had happened was many of the states were not that affected. So the manufacturers diverted their tankers and supplies to Mumbai and areas which were affected. This time around, all the areas around are affected. So it's not going to be that easy to get supplies. So uh, it's unlikely to improve if the government itself can't arrange for itself. And I've been monitoring the situation quite closely, and I don't think it's getting any better. Though on the plus side, maybe the number of cases are starting to plateau out a bit. So the requirement may not rise so dramatically from here on. So I'm hoping for.
Okay, that's something heartening that you're saying, that the situation, that the number of cases may plateau out. But I will come to that a little later, and talk about the hopeful part of it, and maybe how we see the end of this horrible saga that is unfolding before our very eyes. But Dr. Parkar, let me come to you, and I want to ask you about what the hospital staff is going through. We were talking about it earlier. What are doctors? What are nurses? What are paramedics? How are they coping with this second wave? This huge influx of patients, a shortage of medicines, shortage of oxygen. How are they panning out?
Ma'am, first of all, I would agree with whatever Dr. Thadani has said as regards to oxygen and whatever his observations are. And I am totally with him in regards to this. Now, when you're talking about the staff of any hospital who are the COVID warriors, as you would say, let me tell you that it is more than a year that we are fighting this COVID 19. Irrespective whether the medications were available, were not available, whether they were sick, whether they were not sick, the oxygen, the shortage of beds, the vaccines, plasma, everything has come into as an experience over a period of time as the disease has evolved. Now, I think it has reached a stage where nobody can take it anymore. The nursing staff, the attendants, security guards, ward boys, whatever you call them, from the lab, the ones who cook meals for these patients, etc. We are all actually tired. Not only tired, we are fed up, we are frustrated. There is an element of irritation that has come into us, and there is no element of hope. The reason why we are doing this, these lockdowns that took place, the societies that stopped us from going back to our houses, back to our families, all that has taken its toll on all of us. And correct me if I'm wrong, Dr. Thadani. Now, what I intend to say is, until when can we stretch like this? We have all become symptoms of patients of COVID sometime or the other in this 1 year. The trained nurses have been so fed up that they have left because their family is saying, what is the point in, giving your lives when nobody appreciates that? There has been no appreciation, whatever of kind, by anybody. So a lot of frustration has really come in. We are so tired that every day when we meet in the morning, the nursing staff, the security guards, everybody, as you enter, they'll say, how are you? And then the next sentence they would say, uh, we know it's not good, but is it getting better? And then they would say, sir, we all are tired. When would this end? Now, if this is what the state we are in, why can't people appreciate? Why do people have to bash up doctors and nurses if the patient does not survive? We are not gods. Patients who come to us in the late stage having multi-organ failure, or those who are on the ventilators with comorbidities, senior citizens, if they die, what can we do? Many of us have lost their near and dear ones. Have we complained? We have not. We have taken it in our stride. So, what wrong are we doing when we are fighting? What is wrong if we are begging and begging and begging for, say, medicines, for oxygen, for beds, for other supplies, for instruments, for ventilators, for oxygen concentrators? Where have we wronged? I want somebody to say where have we wronged. And if they can say that, I'll be more than happy, and I will do as they say. But that answer is never answered by anybody. Don't we have families? Aren't we putting our children at risk? Aren't we putting our senior citizens, parents, in-laws, whoever they are? Aren't we putting them at risk? And at the end of the day, what are we getting? Are we being paid extra? No, I don't think anyone is being paid extra. Does that any? Is there any incentive that goes into their bank accounts? No. So
You
the
know,
question is, everyone wants to say that if we are not worthy of it, kill us all, no? But on one condition, that y'all should come and save lives. If y'all can do that, kill us all. Otherwise, for God's sake, please stop all this nonsense. Come together, see to it that we get what we want to save lives. In hospitals like Dr. Thadani and myself, if there is a shortage of remdesivir, if there's a shortage of tocilizumab, if there's a shortage of oxygen supplies, how are we supposed to save lives? How are we supposed to treat children? If there are no beds, what can we do? Whom do we go to? So I think we are doing our job, and I think we all have done an excellent job in the trying circumstances. This is a disaster that is happening, and we have to fight over it. I think we have done extremely wonderful job, which people need to open their eyes and appreciate. That's all that I'm saying.
That's a very heartfelt, emotional appeal, I think, coming from Dr. Jalil Parkar. Dr. Thadani, would you like to add to what he's saying? I mean, because the kind of things, very impassioned appeal by Dr. Parker for people to seriously wake up and smell the coffee. How do you feel when there are political rallies happening at one end, the Kumbh Mela happening on another, mass congregations happening at the end, and really this is not about religion or politics. It's like religion or politics is unaffected by this massive sweeping across the country. I want you to talk about what is it that the nursing staff, that the doctors, when they see this happening. You're mute. Please, can you unmute yourself?
So obviously, it's quite disappointing to see mass gatherings happening, and being broadcast. It's so it sends out a very wrong message to people. It shows that there are different rules for you and for others, and it's quite disheartening to see that. And I mean, the people who've attended these rallies and even the Kumbh and many other religious organizations have also held events at this time.
Absolutely.
Yep. And people are going to pay the price for it, right? The second largest akhada at the Kumbh Mela their chief has passed away because of COVID, right? So now they think they will withdraw. And it's a little late in the day to do that. The numbers could have been restricted upfront. I mean, you can't cancel a 5,000-year-old Kumbh, right? But the numbers could have been brought down. It has been done earlier also during pandemics. So I think some pragmatic decisions were needed over there. At least now it's in winding up phase. I hope it doesn't flare up further. The political rallies have been very
the Prime Minister finally tweeted today saying that maybe it should be symbolic, maybe the Kumbh should be symbolic. But as you're pointing out, it's a little late in the day. Probably the damage has already been done.
And it was avoidable. I mean, you can't stop people from gathering in large numbers at Kumbh. So the only thing you could have done was restrict. They did good for testing at Kumbh. They tested thousands of people every day. Right, they were constantly screening. You couldn't enter Uttarakhand without a negative report. But then at the other end of it, we have seen, how people have obtained negative reports as well. So some fault of it also lies with the people who also should have taken their own responsibility, I guess, for their own safety.
And as you pointed out, the mixed messaging. What are people when they're seeing political rallies taking place? And again, I'm not talking about any one particular party. It's every party, be it Trinamool, be it BJP, be it Congress, be it the left front in Bengal, where elections are still there are phases of voting still left. Everyone is out doing rallies. What is the kind of messaging that's going out? There are people who are saying, on one hand, there are doctors coming on screen and saying that no, there are lockdown which is being calculated by the state government, and there are weekend curfews, there are night curfews, and on the other hand, you see these mass gatherings openly happening. So obviously, there's a mixed messaging. Probably the message we need to get correct.
Yes, it could have been addressed. The leaders could have appealed to all the people attending those rallies. Okay, first of all, the rally size should have been restricted. but I guess many political parties themselves opposed restriction of on mega rallies. Right, that was silly.
Right.
At the least that could have been done was enforce wearing a mask, and at least make provisions for some amount of social distancing. This at least could have been done, and it was not done. And the numbers in these states may have been low at that time, but they are also now showing a very steep rise. There's going to be a price to pay for stupidity.
Price to pay for stupidity. But let me just also come back to you, Dr. Parker, and talk about oxygen. And and there is the lack of oxygen. Oxygen is the cheapest blood as far as the treatment of this uh, virus is concerned. Some doctors provide that mortality rates are likely to go up in the second due to lack of oxygen. You believe similarly?
Ma'am, first before I answer this question of yours, I would like to continue in what Dr. Thadani was saying.
Please carry on.
I am questioning this, that we are doctors. We are here to save lives. Why is this question of these mass gatherings or this political rallies or what do you call religious functions in which there is large gatherings? Why are these questions addressed to us? Why don't you all address it to the authorities whom you need to address? You ask us about medicine, we'll answer all those questions. Why are you
Right.
all trying to pull us and embroil us into a controversy so that we...
It's not about controversy, sir. You are out there fighting. You are there
Ma'am,
on the front
we are
line.
already there.
Yeah,
Doesn't the whole of India understand? Doesn't everybody understand? I'm sure everybody
absolutely.
understands. So
Absolutely.
I feel that rather than addressing those questions to us, they should be addressed to the population at large, to the people in the corridors of power rather than
Right.
us. As
Absolutely. They
regards
are
to what you have asked me, no, because the issue becomes that it will become a religious conflict for everybody, and tomorrow people will start gunning for us. We don't have time, and we are not into that. We are day in and day out, 7 days a week, 365 days of a year. We are into this COVID mess. We don't have even time to think. We are fatigued. We are
and
thinking
thank you,
of
sir. And thank you, sir. Yeah.
whatever ways of treatment could be. What is the modality of treatment that we should change and adapt to since the time COVID has evolved? Now, as regards to what you're talking about, oxygen, I think today I was quite happy because our Honorable Prime Minister, he has issued a diktat and I think in a notification where he's channelizing oxygen wherever possible to the best of his ability. That's a very good sign. It makes us more, gives us room of comfort, some hope, and we feel proud about it. Similarly, I'm sure that medication reaching to the remotest of the remote places, whether they are satellite towns, they are smaller nursing homes, standalone nursing homes, multi-speciality, smaller hospitals. Uh, we would be more than happy, and it should be done everywhere around. It should not be. Why I'm talking to you about this is, if we do not get that, if major institutions in Mumbai don't get that, you can imagine what it must be in the satellite townships, where the
Right.
need is more, where the facilities are not there. So there will be, I think, a bigger crunch over there than what we are facing over here. So my only appeal, my humble appeal is that please let us get together. People also should stand up. People also should wear masks, as Dr. Thadani rightly said, should have kept certain social distancing. And above all, I think all these, across the board, across all religions, all these mass gatherings, these festivals, etc., should be put a stop to, irrespective of what that religion is, because eventually it is harming every citizen of India. So let's not politicize. Let's come together and let's see to it that we get over this COVID, if not next year, at least this year. Because I personally feel that this whole year is going to go into COVID. How
Right.
many deaths can one see? Have you ever seen? Has anyone ever seen? And besides that, frontline warriors, the nurses, etc., the technicians, people beg to remain alive. The way you see beggars begging for food, people beg of you that please keep me alive, and that is what you call it. It's an emotional trauma to us every day. While I'm
Right.
talking to you, I have at least 15 missed calls,
Absolutely.
which I have to attend after this. Every time I come out of the PP kit and from the ICU and wards, it's around 3 hours I'm inside. I come out, I have 25 to 50 missed calls. I have 150 WhatsApp to answer. We are also human beings. We also would like to take a small nap, but we have a conscience, and that is why we are still fighting. Uh,
Right.
uh, I'm sure Dr. Thadani must be in his hospital premises. Even now, see the uniform that he is wearing. Imagine the nurses doing that for 8 hours, wearing three
Yeah.
masks, two gloves, that PPE kit, the screen on top of that. The other day, uh, even to talk to your colleagues, you have to raise voice. By the way, I must tell you one important thing. See, we have our own colleagues who are RMOs, etc., and they are also falling sick. The other day, one of my postgraduate students, my colleague who used to walk with me to see all these patients, she became a victim of COVID. And this I'm talking to you must be 10 or 15 days back. Nobody bothered, and she was staying alone because she had rented an apartment outside.
Hmm.
Nobody bothered to ask what she would like to have. At least, have some decency, some humanness. I have sent her food from my house because she did not even have the strength to make tea or coffee. Come on, for God's sake. The nurses, you should see what they are doing. They get up at 5 o'clock in the morning to reach hospital at 7 o'clock. They bring a small sandwich or a small dabba with them and quietly they eat. I mean, don't you all see this? When are you all going to awaken? It is an awakening. It's an awakening call which was 1 year back, and this is the second year now. I really don't know. It's pathetic.
Right. And so the second wave, I really want to, before before I let you go, the second wave, it's also, it seems more virulent than the first wave. And I really, I mean, I understand your appeal to people to please mask up, maintain social distance so the virus does not spread. But what are the precautions, that people should be taking? If, for instance, if I get a fever now, in 2020, if I was in 2020 and if I got a fever, I was told to self isolate. Is that the same process to follow now? What would you advise people? Because hospitals are overflowing. What would you advise to people who are coming to hospitals, fever, or whatever symptoms they feel? And I would like to start with you, Dr. Thadani, first, if I may say.
Yes, the management part hasn't changed, but you're right. This strain does seem to be a little more virulent than the first time around because this time we're not seeing those many asymptomatic positives. Almost everyone has some or the other mild symptoms, and the disease is presenting faster, than before. The lung condition is deteriorating a little earlier than before. Like more younger people are getting affected compared to earlier. We see a lot of young patients, and our ICU is now predominantly people aged between 30 and 45. So that may be because we are protecting the elderly and 45 plus because of the vaccination program. But I know we need to cross check this with with some proper data. Uh, as far as management is concerned, I don't think the management is really any different. we would be doing the same things that we needed to do. You need to isolate for a period of 17 days after the onset of symptoms, and the treatment also is more or less the same. It's the mortality definitely seems to be lower, not because it's less virulent, but because we've just gotten better and better at treating it. So we are now able to predict which patients are going to go bad, and we intervene and stop them from deteriorating. And that's what is actually bringing down the mortality. Otherwise, if you come to the hospital and have a look, it's full of patients with moderate severe disease, because we are not even admitting people with mild disease. So yeah, we've just gotten better at it, and that reflects in the mortality. It doesn't mean that the virus has become tame. So,
But with the mutations that are in play this time, there is this double mutation virus which everyone's talking about, which actually was first prevalent in Maharashtra. It was first seen in Maharashtra. It's even being identified in the UK. But and now it's present across about 3 4 states, including Gujarat, Delhi, Punjab. Uh, that strain of the virus, the double mutant, uh, is it playing out differently? Are the symptoms different? Uh,
Uh, Ma'am, as regards to this virus that we are talking about, let me tell you, even today, we are all naive as to how this virus is acting.
right.
And everybody's perception has been different. The ground reality is that all those who are doing research on these viruses, they will keep on doing. But the fact of the matter is that the suffering is right now. I'm sure that the research will end up with documentation, with recommendations, etc. It might change, it might remain the same. Maybe that might happen a year down the road, 2 years down the road. So all these things, they come later. Right now, what we need to see is if there are any newer medications that have come to tackle the virus which you are talking about if it has mutated, etc. So there, we are landing up with the same thing. There is nothing new that is happening. Uh, uh, the what I would like to point out also, uh, we had a gentleman who was working in the pharmacy in our hospital, and he has become sick. He was taken into the municipal healthcare center from where he was transferred because he became even worse. Now, today he was feeling better, but in the last 2 days, you should have seen the fear, the apprehension, uh, that feeling of hope that somebody would keep him alive. When I asked him today, is everybody back home fine? So he says, I don't know anything about them because my wife is in another hospital, my children are in the other hospital. Can you imagine the trauma, the mental trauma that he is going through? Can't people appreciate this? Don't they have any feelings for the others? He must be the one who must have, seen to it that everybody got the medications right on time. The medicines are released, they are procured. You know, I mean, where is humanity? What are we talking about?
Right, sir.
It
And
is
I
very
just think
saddening.
that
It's
I
very saddening. It's very saddening.
that's a
And
very
that's why I'm
emotional
giving you these
feel. Yeah,
examples because these examples have been, I'm not giving you an example by just talking in the air. These are factuals. So
these are
please,
real
whoever
people,
wants,
and they are absolutely, sir, absolutely. They're real people, real problems that the hospital and the nurses and the hospital staff, paramedics, doctors, nurses, they all must be going through that, and
I would, I would also add further. If you see the health workers, the municipal health workers or the government health workers, they are all tired. The police fraternity is tired. How long will they keep on going helter skelter, trying to request everybody in their neighborhood to wear masks, to maintain social distancing, not to have religious gatherings? Uh, uh, I mean, it's. I think they are tired. The fire brigade is tired. And most important is, and final, which is another appeal of mine, is that the economy is in doldrums. If small shop owners cannot open their shops and do business, I think you might end up with a civil war, because everybody will come out on the road if there is no money. Everybody now thinks and says that if we have to die, why don't we die by just coming out, getting COVID and die, rather than being enchained at home without having any money to feed their own brethren, their own family members. Because if they go to the villages, there is nothing to do. Nobody
Right.
has got huge agricultural land that they can till. The prices are increasing of everything from milk to tea. The tea which you would get for say 5 rupees or 10 rupees, that has become 20 rupees. All your sabzi, your vegetables, from 40 rupees, 80 rupees, 120
Absolutely.
rupees.
No denying that a lockdown, which is currently in progress in many parts, in
People
various
have,
states.
if there's a couple, one of the, and both are working, one has lost the job. The other one has also got a 20% reduction in his salary. So how are they going to make their ends meet? I think we should think about that. And most important is, I think the federal government as well as the state government, we should see to it that we invest more in health, because health never generates any income in any country. So if we invest in
Just
health,
while you're talking, sir, there is a news flash which has just come in on my phone that the Prime Minister will hold a meeting to review the COVID-19 and vaccine situation in India tonight itself at 8 p.m. Top officers across various ministries are going to participate in that meeting, and that vaccination drive. That is the question. You made an impassioned appeal to people wear the mask, follow COVID protocols. You made an impassioned appeal to state government and central government as far as managing this crisis is concerned. What more can the government do, especially, and I'll end with this and I'll take both your opinions on this, and I'll come to you, Dr. Thadani, after Dr. Parkar here. What more can the government do? Should vaccination be opened up to all? Is that a solution? Dr. Parkar?
yeah,
I'd like to go with
uh,
Dr. Parker first, please, and then Dr. Thadani will come to you after that.
yeah.
Yes.
Ma'am, I think the government is trying its best to see how they can get over this COVID. Unfortunately, what is happening is that we have such a huge population and diverse. You see, uh, so government is really finding it difficult, because there are many who are of the thought, okay, this is all nonsense, this is all a hoax. That's number one. A majority of the population. Number two, uh, there are a majority of the population who feel that medicines like remdesivir, like tocilizumab, they are all nonsense, they are all useless. Why should we spend so much? You see people walking on the road, nothing happens to them. Why should we be enchained? So I think government is trying its best, but our population is so humongous that it will take some time for us to inoculate everybody with this vaccination. I would strongly recommend that each and every one of every age group, I'm not talking about the pediatric age group, because that's not in my purview and my knowledge is poor in regards to that, but even the adolescent about the age of 18, etc. I think if possible, everybody should be vaccinated. That's number one. Number two, people who are affluent or who can afford, I think they should come forward voluntarily and see to it that they pay up, maybe for one person, maybe for 4 persons or 2 persons, so that the poor can also get inoculated, vaccinated. So,
Right.
at the end of the
I
day, I feel
Yeah.
that we all need to rise to the occasion. Please rise to the occasion.
We all need to rise to the occasion. Dr. Thadani, let me just come to you and then we'll end this broadcast. What do you think? Does the government need to recalibrate its vaccination strategy given the second wave and which definitely is more varied than the first wave? You're on mute. Please just unmute yourself. Thanks.
Yeah. So they are actually doing it. The fast track permissions for Pfizer, Moderna, and Sputnik has already been granted permission. So they are liberalizing it in a way. They've also realized that you can't just postpone these decisions further. And I think it's good. I think there is a legitimate case now for the vaccination program to be extended across the country. It has to be done with the collaboration of private sector also. See, like even when you're talking of pediatric vaccinations, the pediatricians give vaccines to the kids in whoever can afford. The government gives vaccines to the kids who are in the municipal setups or in the rural areas. Right? So that's how vaccination programs have been. We should not chase a number on the board that we did this much vaccination today, we did that much vaccination today. You can do 10 times of that if you let go of controls and make the vaccine freely available across medical stores, across hospitals. Let them purchase and deal with the vaccine companies directly. You just handle the permissions part of it, right? If there is enough vaccine to be purchased, if there is enough vaccine to go around, why not do it? You will be doing it 10 times faster. Maybe in less than a year, we would end up vaccinating the entire country. So yes, there is a lot to be done as yet. I think the numbers should not be chased.
I totally agree with what Dr. Thadani is saying.
Right. So,
Absolutely.
so what you're both basically saying is that the government is already doing a lot, opening up vaccines, putting in more vaccines, approving more vaccines, but a lot more can be done to make the vaccine freely available to all, and therefore vaccinate a larger population so that the immunity starts taking hold. Thank you so much for joining us today. One message that we see very Dr. Parker, and that is about how we all, as a nation, need to come together as one in this time, because this is truly a national emergency. COVID, the second wave, the manner in which it's growing in leaps and bounds, we all need to come together. Till about 12 days ago, we were 100,000 cases a day, and now we're almost 200,000 a day. So it just took about 12 to 13 days to sort of double number of daily positive cases in the daily case. So let's all be extremely careful. Let's all their responsibility, individual, family, social, community, wear that mask. And Dr. Parker, I really want to, let you end this with an appeal to everyone.
Ma'am, my appeal would be that we doctors uh, have time and again, in spite of being overworked, in spite of being tired, we have come on television to see to it that the awareness is there of the criticality and the challenges that we are facing with COVID 19. Uh, I would like whatever we are saying to reach the masses and also to reach to the echelons of power and whichever party it might be, whether they are bureaucrats, I don't know, whoever they are in the corridors of power, please, for God's sake, get together, get our act together. If we have faltered somewhere, let us come together, rectify our shortcomings. Even now, it is not too late. And to the citizens, I would say that please follow the guidelines to the best of your ability so that we can fight this COVID and we do not see deaths the way they are right now. That's my only request. Thank you.
Thank you, sir. And I already feel guilty for having taken up so much of your time at a time when you're clearly very heartfelt for just that, which is time. Thank you so much for joining us, viewers, for this broadcast. We keep coming back to you more. Stay tuned to Times.com.